Welcome to the Wild West. This is the War Pony podcast, where we are your trading post for all upcoming productions, connections, and tricks of the trade. I'm your host, Cassidy Honey, bringing West Texas to you. I am a wife, mom, businesswoman, holistic equine therapist, and team roper. Relax and watch the sunset as we highlight events, consult on business, share knowledge of the industry, and talk to the legends and rising stars of the community. Join the tribe and make War Pony your one-stop shop for all things West Texas. Well, welcome to the War Pony podcast. I'm here with Taylor King and Jordan Williams with Royalty Veterinary Services. So we are excited to have you guys on here.
Thanks for having us.
So if you guys don't know, Taylor is a vet here in Gardendale. She has pretty much anything you need. I'll let you kind of tell them what services you offer.
Yeah, so I equine, of course, and focus on primary care in a lot of ways, and then kind of performance medicine, sports medicine type of stuff. So we can vaccinations, Coggins, floats, that sort of thing, and then injections, chiropractic work. It was just some minor surgeries. I'd be the first to tell you I'm not a surgeon, not my cup of tea. And so if it's, we try to do our best to decipher the cases, and what we can do for you, we do here. If not, then I try to get you to the ones that can. So, but we really enjoy the sports medicine. And I'd say in the last couple of years too, our reproductive work has really picked up. I feel like the horse market in general has just really taken off, especially with all the maturities and the incentives and just driving the horse industry. And so the
breeding game is definitely become a new thing.
And it's fun. It's fun looking at these mares thinking, oh, I want to, it's a game. It's like you said, it's a game. It's kind of a mixing the puzzle pieces and trying to match the studs and see what happens. And it's fun. You see those babies out there running around. You think you had a part in it. They're also very frustrating.
Yeah.
but they're
all
fun.
The hours, and there's no schedule in breeding season. That's for sure.
No, it's tough. I always tell people, bear with us during breeding season. And then this last breeding season, we had our little girl. And so that was even more of a challenge, but a blessing.
Didn't you have a colt born close to the same?
We did. We had a little filly out of our own stud born the day before. And so fun neat. Fact, we do offer to run plasma to your newborn foals to kind of an immunity booster. And so I had to be at the hospital, I think, at 8, and my sweet mom was up with me at 5:30 that morning running plasma to the baby before we went to the hospital. So it's neat seeing them kind of grow up together, and I love having the kids in that environment and get to see all aspects of it there. So.
And you first started, well, I guess let's back up. When you went to vet school, where did you go to vet school at?
So I did my undergraduate work at Texas Tech University, and I was so blessed there. They have a great animal science department. I'll say in particular, I had Professor Dr. Sam Jackson, and he really, I remember sitting in his office one day, because I actually started out in the ag communications department, and I was a student athlete as well. I played softball at Texas Tech, and
I never knew that.
Yeah, and I'll, I guess, elaborate on that, how it kind of drove my choice. But I was hesitant at the time to go pre-vet route because of some of the classes and trying to juggle that with the sports. And I remember sitting in Dr. Jackson's office, and he told me, he said, about 100 other of your buddies are out there all saying they're going to go to veterinary school too. And he said, when it comes down to it, there's going to be maybe 10 of you that make it. And I told him, I said, well, let's go be one of those 10. And so we went from there, and he really helped open the door for me, opportunities. And so from Texas Tech, I went and did my veterinary school at Texas A&M. And that's kind of backing up playing sports in school. I feel like that's what really drove my sports medicine desire. Is kind of mixing the
athletic side of the equine industry.
Because I've been there, and I know what it feels like to be sore and to hurt and not feel your greatest, but you still got to try to go give 110%. Or what are the things that we can do to try to optimize your athleticism? And so I feel like I try to take that and own personal experiences. And even in some cases, some of the exercises we did, on the human side, and put that over on the equine side. And I just to love seeing them be able to perform at their best. And then when you see those horses really enjoy what they do, know that feeling.
And when you got out of vet school, like where was the first place that you found to do practice?
Yeah, I did a 2-year internship at Brock Veterinary Clinic. I learned a lot, and I got a lot of hands-on experience. It was a blessing there for...
They do a lot of that.
Yes, for the amount of hands-on that I got, because I know not every internship is like that. And so they really let me get in there and get my feet wet, and I sure appreciate that.
I was actually... I met a guy in March at the American, and he was graduating in May with his, and he had did some internship stuff or extern when you're at a clinic. I'm not sure exactly which it is. And he's like, I've maybe injected 2 horses.
Yeah.
And he's like, it's so scary that I'm about to have a veterinary degree with limited hands-on experience. And so I think that is something that's so neat at Brock's is, you do get the professional experienced overview, but you are letting the new generation of vets actually get experience.
Absolutely. Yeah, they were great about that. Let me, like I said, get hands-on and get in there and get the feel for it, because otherwise, and until you do it, you just, you've got to have that experience. So I really credit them. And then one of my best friends, Dr. Lindsay Horner, I worked for her when I was in veterinary school. She has a single doctor practice in North Dakota. Same. She threw me in there, and it was me and her a lot of times. And that was just leaps and bounds for my career and the confidence you get. And then, like I said, that hands-on, you just can't replace.
What brought you to Gardendale?
My husband.
Over here at Shady Acres.
Yes, my sweet husband, Corey. A lot of you know him as Shady. He actually grew up in Slayton outside of Lubbock, so he's kind of from the West Texas area to begin with. Spent a lot of time in Stephenville, and then had a job opportunity back out here. And
here you are.
Everything
and he ropes. Up. Those who don't know, he ropes.
He ropes. He head and heels team ropes.
And now we're raising some little cow kid babies.
Yeah, we got one that I think's going to follow in his footsteps pretty good. So, and then yes, we have a 6-month-old now, little girl, and she's just a sweetheart. She's such a blessing.
So, as we mentioned, we also have Jordan. Jordan is Taylor's right-hand man. What does that look like for you, Jordan?
Everything.
What does your day-to-day kind of consist of?
Whatever Taylor needs done, I just kind of read her mind and assume what she's going to do next and try to be one step ahead of her, maybe. But answering phone calls, scheduling appointments, getting ready for injections,
trotting horses,
part-time babysitter.
Because,
not really.
I mean, I think something that's really a unique dynamic here is like it, for the most part, you do have other employees that work for you, but a lot of the times you are a single doctor practice. So, it's kind of like you don't have one hat, you wear multiple hats and you do what needs to be done.
Well, I say everybody needs a Jordan in their life because, Jordan does. I don't know what I'd do without Jordan. Yeah, she does everything. And I always tell people anything I can answer, Jordan can answer just the same. So
quit asking for Taylor.
Let's talk about your life outside the clinic. What do you do, Jordan?
Well, when Taylor lets me leave. No, I'm kidding.
She holds you hostage.
I like to run baby barrel horses, and Taylor lets me go almost every month for a week at a time and go to these futurities. And I'm either here, I'm at a futurity.
You've had some good success this year.
I've been lucky. Yeah. It's worked out for my first one, so I'm pretty excited.
And let's talk about Coda.
She's great. I mean, she does it all. I just kind of hang out up there. She knows her job, and she's paid her way to keep going. And Taylor just tells me to keep going.
And you've pretty much trained her yourself?
With lots of help. This is my first one I've trained, especially such a young one, but I've had a lot of people help me along the way. But yeah, my first one to train and haul and go on my own. So I'm pretty happy with her.
Yeah, it's exciting. So Taylor too, you are starting to get more into the barrel racing also. This is that dynamic duo, y'all. Just ching and chang over here.
It's really fun because, Jordan and I'll see cases and then we'll talk about it and how that ties into the barrel world. And again, the breeding stuff. We love talking, I think, the studs and what we could cross with this, and then drills and medicine. It's fun when you have the same interests. And then that's what really again makes Jordan a huge asset here is because she's in the industry. She dives in. And so I hope people, when they come here, they know their horse is going to get treated the way we want our horses treated. And I think that's the biggest thing, you know, in having a veterinary assistant is that they give that same level of care and respect to those horses because, again, that's how she wants hers treated.
Yeah.
And so it makes a huge difference when you have people involved in the industry, and I really love it. But it's fun. Jordan and I have been getting to ride together, and we do a lot of things outside the clinic.
I know the other day
So-
when you came up to one of my events, I really thought you were her walking in. So there's that.
Yeah, when people joke that you have to have blonde hair
Yeah.
and this.
Yeah.
Yeah,
I'd
to
say probably
work
a
here,
pink
but-
hat, maybe a black tank top,
Yeah,
light colored
that's-
jeans. It's
yeah,
usually about
normal.
how it goes.
You caught us on an off day,
Yeah.
but
I know.
normally that's our go-to.
So when you first came down to Gardendale, you were a mobile clinic.
Yeah, it started out mobile. Again, just kind of trying to get our feet wet and get in the door. But I'll say too, it was the COVID year. It was the 2020 year. A lot of things were kind of up and down and unsure. And I remember looking up and saying, "God, are you sure this is what we're supposed to do?" And we've just been so fortunate. He just keeps blessing us. Since then, we now do have a brick and mortar here. When my son was born, we got that built, and he's 2. And then now having our little girl 6 months, it's gotten hard to be on the road
Because you are essentially on your property. Like your guys' house is right behind you
Yes.
in your arena. So,
Mhm.
you know, you do essentially work out of your home environment, which is
Mhm.
helpful with the kids.
Absolutely. It's just been, it's fun to have the family involved. And I'm glad you mentioned that because I always try to tell people this. I never want to, people feel shortchanged, whatever. But, you know, as far as medicine cases, I'm good at, you know, we're good at some to an extent, but I think we do get limited. And that is one of my biggest limitations is our clinic is on our place. And so I've got mares and babies. I got, you know, the rope horses and everything right next to it. And
Personal
so,
horses
Yes.
and everything else.
so a lot of times, I mean, if you have an infectious case or, you know, an isolation type deal, and unfortunately we are, you know, we
You're not
send
inside a
people out.
hospital.
Yeah, we're not set up really with an isolation area. So we're kind of more of an in and out treatment type of stuff. So I do warn, you know, caution people of that. But overall for me, it's just been such a blessing. And like I said, my mother-in-law helps with the kids during the week and they go to the church a couple days, but it's fun. You get to work and then at lunch go see them and, you know, having them in and out of here and being around the horses. So it's great for a family environment, what we've got.
Jordan, would you like to tell the story that happened when Taylor was about to check that horse the other day with her son?
Connor was sitting.
Do it. Tell the story.
Oh, this is your story to tell. You're a lot better at it than I am.
Well, I feel like I'm going to have to tell them, you know, when you go to school and other places, like there's things that
Happen at the clinic.
Yeah,
that
that
stay
we
at the
probably
clinic.
just don't talk about, you
Uh-huh.
know, else, but some people just don't understand. But I was about to preg check a mare and went to put my sleeve on, and my son is sitting in the room and he's in front of everybody, just yells,
All the clients.
"Oh, yeah." He goes, "Mom, are you going to stick your hand up her butt?"
And if you know Taylor, you know she got really embarrassed in that moment, which made it even funnier.
You just never know what he's going
I
to say.
love it.
So he definitely knows
Yeah.
what's going on.
He knows
out
what mom
here.
does.
Mhm.
Oh, you know, whenever you're like, he gets like, what does your mom do? And he's going to draw the picture.
Yeah.
And who knows what you're going to get.
I'm afraid the school office is going to have me on speed dial.
Yeah, my favorite's like the ones that you think like they're about to be a stripper and it's like my mom's like sweeping or something, right? And the teacher's like, well, they drew a picture of you today. And she's like, I'm a house cleaner or whatever it is, you know. So there's no telling what
Nice.
Connor will come up with.
Oh, I'd tell him, like, just don't listen to everything he says.
Yeah. So you definitely do a variety of things. What
Mhm.
would you say your specialty kind of is? You mentioned like the performance side and keeping equine athletes going. Like, what does that
Yeah.
look like?
We do a lot of joint injections, you know, therapies that way, diagnostics we have available is x-ray and ultrasound. You know, if we need more advanced from there, then we try to, again, get you to the right place you need to go. But really, you know, enjoy that part. We have different options as far as joint therapies and some cool things that we've incorporated into the clinic.
You
Like-
just had to deal with that Alpha 2.
Yes. Yeah. And that's what I think is really neat. So we have a variety of options that we can treat the joints with that aren't just steroids all the time. And there's certainly a place for them, and I think they're great. But us just being able to have other products, and like you said, the Alpha 2, some of these regenerative therapies where we actually use the horse's own blood, we are able to spin it down here in house and then treat them that way. We do a lot with a product too, called Renovo. They've been a great company for us. I've seen a lot of great results. Another type of regenerative product. So I feel like we try to have that discussion with clients about which one are we going to pick? Where do we start? What works for you and this horse? I really enjoyed that and the chiropractic work. And like I said, the Repro, if you ask me in February, I really like it. If you ask me in June,
You're over
I'm
it.
pretty tired.
Yeah.
but it's still good.
I think one thing is I've been coming here for several years. I will say that when you scrub a joint, it is the cleanest thing ever. And I think and I'm not knocking any other clinics. I think that that's always a very high importance. But I have watched for 10 minutes Jordan scrub one hawk. And at one point I'm like, girl.
Yeah, like, it's good.
We'll give it some, I don't know, some sort of penicillin. It's fine.
Well, that's where, again, I brag on Jordan. It goes back to her being involved in the industry because, again, when we're prepping those joints, when we're doing those sort of things, we're going to treat them just like we want that futurity horse treated, So we're going to take every precaution that we can. This is just us. And I always tell people it's probably more for me than it is the horse, but when we prep the joint after the injection, we're going to wrap them. We're going to put them anti-inflammatories. We're going to send you an aftercare sheet home of what to do, what to watch for. So we try to take every precaution that we can because we want the best for you. We want the best for your horse.
And I think Jordan can vouch when I say this is you take things very personally and you give the best advice as if it was your own. You've told me several times, absolutely not, or this is the best case, or, I've even had, I don't know if it's necessarily the pleasure of working with you whenever I was losing Buddy, but you looked at me and it was like, this is what we got to do. And it was appreciated because I couldn't make that decision in the moment. So I think that is something that goes really highly of you and your clinic.
And that's where, again, God has just blessed me, I think, with this environment and a family and, again, a work team involved in the industry. So we always try to put ourselves in the client's shoes. And I try to, because I get on this, you get on the veterinary side of it, and then you got to put yourself through the client's eyes as well, too. Manner. Mm-hmm. Yes. And so I try to think if this was my horse, how would I feel?
I was actually crying. That was a very touching thing.
Buddy was so
Are you
horrible.
okay? Yeah.
No,
that was
am I
going to say it? Then I said, holy crap, I said it. And then I was like, oh God. You started building this 2 years ago, and now you have a brick and mortar, and you have recently done some additions. You do have a few stalls for some clients and things, but you've recently opened a little storefront. Jordan, you want to tell me about your storefront?
Well, we don't have a ton of stuff going on, but we have some caps and halters and tail bags that have the Royalty Vet logo on them. And I think it's so cool to go to Jackpot somewhere and see someone's horse have a Royalty Vet tail bag on it. Or, walking
it's the
through.
Support.
Yeah, just walking around and somebody has a Royalty Vet cap on. And that people want to wear it. I've literally had people come in here and I saw your tail bags. I just wanted to come get one. No appointment, just wanted to come and grab one. And I think it's really cool that so many people want to support Taylor and support her clinic and be a part of it.
And you've recently kind of added some Zestera. You've had Zestera for a while, but you've expanded, right? So what is the Zestera product for those who don't know?
For me, for our environment out here, we're just not fortunate to have a lot of the natural grazing. So I recommend people have some sort of lick tub in there. And I've liked the Zestera product. For the ones we carry, it also has the feed through fly repellent, just to kind of get an extra bang for your buck there, I guess. But I think it's a great product. It seems to really help keep the horses drinking, everything like that. We carry the liquid as well. A lot of our clients use that on the road. We use it on the road. I've also especially a gas colic, I think it can be really beneficial. So we've started incorporating those products into our clinic. And just to brag on Jordan about the tail bags and the caps, the halters, those sort of things, her ideas, and that she's reached out and she has researched and gotten some good companies where they're quality things. And so I think that's the basis. We want these products, it's good advertising, and we like to see our people out there sporting them, but we also want you to have a good product and something that you like and lasts and works. And I think Jordan's done a really good job of the things that we carry, having some.
You even put some just quick grabs as far as, good things to keep in your trailer and stuff like that.
Yes.
I didn't do that.
What are some of the products that I guess since we're talking about products to go in the trailer, what are some things that you would say to put together for people?
I like for all of my clients really to have some Banamine on hand, and that whether be you're in a bind somewhere, you can't get some, for any type of colic case. Even any swelling, that sort of stuff. And I always encourage people, please call us. We'll tell you how to administer it or whatnot. But if we've got a good relationship with you, client, patient, I want you to have some Banamine access.
What you need to get somewhere safe.
And a lot of my people on the road, I do, again, Banamine being an anti-inflammatory, Butte, some of those horses certainly need that for their performance.
But you even have some wound care products too.
Yes. And I'm we kind of make a concoction here on our creams that we send with a lot of people, but bandage material, some of your liquid bandages, all those things. And when we will put a kit together for you, we've done it for some of our college kids and things to have on the road, but
things you don't think about until you need it.
Yes. Of what we kind of consider essentials, where even if you can at least put a Band-Aid in a sense on it until you can get where you need to go. So at least you're not just stranded somewhere if you.
And then you have Zestera, but then you also have Platinum.
Mm-hmm. I'm a big Platinum fan, and a lot of these products, I always joke in the clinic and say they don't pay me to say this. I wish they would. They're listening.
Shout out Platinum.
But I really like the Platinum products. They're very well researched. It's not a product you can get over the counter. It is going to be prescription based. So you can get it here in the clinic. We can special order certain things, or we can get you set up with
a little bit more quality control on that.
Yes, it's veterinary founded. A lot of research has gone into those. And they also offer a direct dispense portion where we can, we agree on a product for your horse. We can get it shipped straight to your house too. So they really stand behind their stuff. So happy to have them in the clinic here.
I like that you have a little bit of everything, or a little something for everybody. You can come in here and get your routine vaccinations or health papers if you need them. But then you can also come and, I need a Chebabute, or I need whatever it is. And so that's nice, because you don't think about those things until you do need them.
Yeah, we try to have a in-house pharmacy fairly stocked. There's certainly going to be certain products we got to order, or just hard to keep on hand.
How has your ordering kind of been with? I know, during COVID when you first started, it was everyone's things were wild. But what does that look like now? Is it better for you?
I'd say there was a time that, especially during that COVID year, I couldn't get alcohol, and I was like, how am I going to scrub a joint without alcohol? And I remember going down to the CVS, and they had it on allotment, you can only buy 2 of these little bottles. And I gave my biggest eyes to that lady at the register and batted them, and I was like, I'm a veterinarian, can I please have some more? And she goes, oh yes. She let me buy out their whole alcohol stock, at the time. And I was like, I have to have this to function. And so it was sketchy, to say the least, during that time, especially on products. It's gotten much better now. Every now and then there will be some weird things go on back order. And of course, it's always something that you use. One of our ovulation drugs this repro season, all of a sudden we're going to have a hard time getting. And
right now it's 12 cc syringes. Yes, we can't get those
12 cc syringes. So those are the fun behind the scenes things that Jordan unfortunately has to deal with a lot of times and try to find us an alternative. So again, everybody needs a Jordan.
Everybody needs a Jordan.
We'll figure it out. We'll make it work.
Yes. Cloning is a thing now. They did. Just saying. you're in the repo. You might as well just get in the cloning thing.
Here we go. Might as well.
Might as well.
If you're going to do one thing, might as well do the other thing.
So what is something that is really neat that you've had the experience with a client?
I think my favorite part, and I want Jordan to elaborate on this too, but I think my favorite part of some of the stuff we do is then seeing those horses out there and performing and seeing people be successful. And so, if you kind of mention like one particular case, I don't know that I have one. I can think of multiple, but like, for example, I'm going to use a few names. But when I see Jordan winning the Futurity, I'm like, that is cool. That's a horse that we've spent a lot of time on. We've analyzed her to try to get her to perform her best. I'm going to shout out to our good friend Katie Scott. I mean, watching her run at Calgary on TV in the finals.
That was so neat.
That was the coolest
I
thing.
mean,
episode coming soon as she gets back home.
Yes, I mean, I was on the couch riding with her. I mean,
That was
We were huddled up in the clinic
we were
just
whooping and
waiting.
riding, yes. So when you see that, them be successful and them be so happy and enjoy what they do, that's, I mean,
they
it's
come from the
what
same
it's all
place you're
about.
at, right?
Mhm.
Like,
Yeah.
it-
And that's
you're
why,
part of the success.
yes, and I'm glad you bring that up because that's what I tell people. And we're not little West Texas. We got some nice horses out here. We really have a lot of talent.
We just get a little overlooked, and that's
We
yes.
do.
where
We
I
do.
wanted to start this journey. Is let's put us on the map
Yes.
because it is salty out here. There are
Mhm.
really nice horses. There's
There
a lot
are.
of money. There is some. If you go to Vegas, I mean, 30% of the world is coming from right here
Mhm.
in the Permian.
Mm-hmm. Our high school, our junior high level, I mean, our regions are tough and they're great and they're gritty. And like I said, these horses are nice. And that's why we've tried to incorporate, the Alpha 2s, the Renovos, these other products. We've tried to advance so that we can help these horses advance too.
Well, and I think
Mhm.
it's safe to say horses are getting more successful at a younger age.
Mm-hmm.
So you might be a little bit more hesitant in your 3-year-old to go stick him with a bunch of steroids,
Right.
where 10 years ago it was your 13-year-old. So you're
Mhm.
like,
Right.
oh, okay. Like
Right.
the industry is changing so much.
Absolutely.
When you do find out that information, like how do you find out about these new drugs and things? Because you do have like continuing education nights and stuff.
Mhm.
So how do you find, is there like some sort
They
of,
call us. They call us and try to sell us.
we have some good reps.
Yeah, we do.
I think we've been blessed with some really good representatives that try to keep us up to date. We're a part of the American Association of Equine Practitioners, tries to keep us up to date on products and those sort of things. Again, I kind of go back. You get you a colleague, tight circle, those that you bounce cases off of. And there's been many times that, for example, Dr. Lindsay Horner and Dr. David Wolf, I have to say a huge thank you to them because
and neither one of them are local here.
No, and they're all different parts of the country, and I talk a lot with them too, and I'm so thankful they always answer my phone calls. But it's neat because they'll say, well, this worked for me, or have you heard about this, or have you heard about that? And all three of us are kind of in, or at one point or whatnot, I've been in single doctor type of practices, and so you lose that, not
Bouncing
having
ideas off of
and-
the colleague conversations.
yes, and so having them,
And it's easy to overlook or think, or it could be this and it could be that, or oh my
Mhm.
gosh. And,
Mhm.
it's,
So I feel like you kind of help try to keep each other up to date and be like, hey, have you tried this? Or have you heard about this or whatnot? And so, and then I'm glad you brought that up. So we've tried to incorporate that. Jordan does a great job on the social media and advertising and making the flyers, but we try to a couple times a year do a client educational meeting because I feel like you're going to get your resources from somewhere. And we try to make it where you get it from the most accurate, most well-researched source possible. So we're going to bring it in and give it to you straight from the horse's mouth from these companies that have these products and that
and
have
you've
the
even
data to
had
back it.
reps from those companies
Yes.
join you in those. And that's
Yes.
important because you've opened up for, your client to have a question that you may have not thought about or
Mhm.
something like that.
Mhm.
So it is neat that you do all those things before you just take on something.
Yeah. We've been fortunate to have people willing to do that. And again, I come back to, I tell these reps when we're trying to set up these meetings, I say, look, we've got some of the best horses in the world out here. You may not know it, but these people need to know and come educate, come share.
What are some goals you have for the clinic in the future?
We've just been so blessed in the short amount of time, that we've been here, and
Yeah.
I brag on Jordan because we just have a fun camaraderie, and I hope when people come in here, they enjoy it. And some people ask about expansion and that sort of things, and I, as far as more doctors or whatnot, I don't know. I like the small environment. I like the one-on-one.
Well, and you mentioned like this is a way of life that you're raising your kids too.
And if God opens that door and says this is where you need to go, we will. But we had somebody call the other day and leave a message and said, "Hey, well, one of you girls give me a call back." So I like that because they know who they're talking to.
It's very personable.
Yes.
It's just not a clinic. I mean, I've called you at multiple times, and I call and I think I give it about 3 rings on your phone, and then it's Jordan.
Yeah.
Or
Corey.
Yeah. Oh yeah. I did get some cows out. Yeah.
Yeah.
Oh gosh. What is that girl's name? That poor thing. It was her first day and my cows were out and I was freaking out.
Yes.
And all I could think about, like, all right, if Corey's home, this is gonna be okay.
Yes.
Mondo had no service, you guys were doing something, and she answers the phone on the first day. She's like, "Hello, this is what's her name?"
I think it was Camber.
It was, yeah. And I'm like, wait, who is this? Because it was so different, And I was already in a panic. And I was like, is this Royalty Vet Clinic? She's like, yeah.
Did I call the right number?
I was like, can you put Taylor on speaker? And I was like, I just need to know if Corey's home. Like, I got cows out.
We need somebody.
I am SOL. And it was a mama that just had a baby, and she was a heifer. A heifer. And I was like, this isn't good. But yeah, no, it's neat to be able to have those personal relationships. And a lot of your clients, you do get to go compete with them, whether it's the barrel racing or the team roping. Like, you get to go see them. I've been numerous times to the same team roping, competing and getting to see you there. And it is cool to see it all kind of come together. And I think that one of my biggest goals and hopes with War Pony is that it brings everybody like that together. It's the small supporting the small.
Right. And that's what so I think as far as the clinic, I want our services, we were fortunate. We were recently able to purchase a scope, so it's equipment. I'd like equipment advances and those sort of things, but I really want to keep it on a personal level. And I want people to feel like when they come here that they got the one-on-one attention, and I had to say, please bear with us. Again, being a single doctor practice, some days are crazy and there's emergencies and it doesn't go as planned, but we do our best to try to give you the attention.
Well, you make sure, like, even if someone's waiting, you're still giving them that time.
And like you said, when we're at the events, if we're at a barrel race or a team roping, that is what's cool with seeing your clients and those horses out there. I'm cheering for every single horse that we see out there in the arena.
So how can people contact you? Like, what are your hours and how can people get a hold of you?
Call Jordan.
Between the days of Monday through Thursday, 8:30 to 5:30, 8:30 to 1 on Friday.
And we do that. Some people ask about the Fridays. That's kind of, I feel like we try to get things wrapped up and I get to get my kids and be with the family and, that sort of stuff. So we kind of try to push everything up into the week. And then, and a lot of times too, I'll say that's what we're competitors as well. Again, talking about Corey and Jordan and everything being on the road. And so a lot of times we're headed to a roping or going to a roping. And if I always tell people, if you're there and you need us to bring something, let us know. We're happy to try to help there too. But to kind of go over our hours, we do have a website, royaltyvet.com. We should be on Google Maps for all of that. So, but the number to the clinic is 940-704-8152.
Do you think you'll ever change it to a 432?
No, I wouldn't remember it.
It throws people off.
Yeah, too many people have the number. We can't change now.
No, for sure.
And Jordan will be happy to talk to you.
And you do take emergencies?
We do. We take emergencies after. I tell people if you have an emergency after hours, it says it in the voicemail, but just call the line twice.
Like a bad girlfriend, I've done it.
Yeah. Call the line twice, and
going.
it'll push you through.
Well, I always end all of my podcast with the famous question: is why is West Texas special to you? So, Jordan, you can go first.
I didn't prepare myself for this question.
That's why I asked you to go first.
Because she's so thankful to work here. That's why she loves
Taylor
West
makes
Texas.
West Texas special.
Oh my god, you guys should start.
That's
your
my
own,
answer.
Like, you guys should like mic up one day and just have your.
You
own,
should
like,
mic us up
I'm
throughout
going
the
to
work
mic
day.
you up. Yeah, no, maybe not you during the work day.
It'd be entertaining.
It wouldn't be boring.
What's
You get
your-
lots of ratings.
Why
Come
is West
on,
Texas
you-
special to you?
It's the sunsets.
The sunsets and your family.
They're great. I mean, they drug me here, so it's fine.
Where are you from?
I'm here.
They drug you here.
I don't have a good answer for that question.
It's actually a
I
pretty
have to like it.
in-depth
I've grown
question.
up here. I don't know anything else. Like it.
You did
home.
move away for a little bit, didn't you?
Yes.
And then you're here.
I'm back. There's something about Odessa that just pulls you back in. You can't ever leave here.
Sucks you in. It's kind of
Yeah.
like a black hole.
Yeah.
You're
You
once you're
can't
in,
ever
you're
leave.
in. Taylor.
I love the people. I just think we have a great, and what you're doing here and the people you're reaching out to, we have a great Western community, horse community, however you want to look at it. It's nice, down to earth people. And I think it's fun. Like you kind of get in this world and you tend to know, everybody knows it's kind of a circle, all the way around. And like Jordan said, the sunsets are nice. It may be a hot desert during the day, but when the sun goes down, it's hard to beat a West Texas sunset. And people always from home, they'll say, well, how do you live out there in that desert? And I said, yeah, but when you travel anywhere else, it's always cool.
Yeah. You really get to enjoy when you leave.
you really get to enjoy everywhere else in the world because it may not be the most beautiful scenery during the day, but the sunsets, you can't beat that.
Well, I really appreciate you guys taking the time out to be on the podcast and kind of tell everybody a little bit about what you do and who you are and how you got to where you are and things like that and what to do to get ready for Vegas and everything else. So thank you guys so much for all the time.
Thanks for having us, and we're excited about what you're doing and reaching out to this community of people. I think it's, like we were talking earlier, your source of information and stuff, and I think you're onto something really cool.
Well,
So,
thank you.
Thanks for having us.
Thank you.
Thanks.
Stay tuned. Thank you for listening to the War Pony Podcast. If you have a story to tell or want to be a sponsored ad on our podcast, you can always contact us at Cassidy@warpony.co. That is CASSIDY@warpony.co. Or you can always find us on Facebook, Instagram, and TikTok at War Pony Co.